Assalamu alaikum guys, how are you all? So today the journal surgeon is again here and we are discussing about the history taking of a patient who came with the bleeding per rectum. So let's talk about the history. Okay, so continue with the history. Let's start with the first would be introduction and consent from the patient, then ask about the biodata of the patient, and then comes to the presenting complaint. Okay, either it could be the patient usually presents with the bleeding per rectum, or constipation, or loose stools with blood, and something coming out of anus, and abdominal pain, okay. So these are the presenting complaint with which patient can present to you. So now continue with the history of presenting complaint. First, start with the first complaint would be bleeding. So the questions would be the duration, for how long you are having this problem of bleeding per rectum. Then ask about it, how you noticed. Either your clothes are soaked or your underpants are soaked. So this is very important. Then ask about the frequency of this bleeding per rectum, like how many episodes per day. Any specific time, like in the morning and the night time, so it's also important. Then ask about the quantity. There is 1 tablespoonful, 2 tablespoonful, half cupful, so it's very important. Then ask about the color of blood. There is red, bright red, dark maroon, like old clotted blood, so it's very important. Then ask, like, either it's if it's mixed with the stool, or like coming through the anal canal after a stool, just like a splasher of blood. Okay, then ask about the mucus discharge in stool. Then ask about the constipation and loose stools if yes, then the duration and frequency, amount, color, so these are very important. Then ask about the altered bowel habits. Then early morning spurious diarrhea or early morning bloody diarrhea. Then ask about the tenesmus and finger evacuation of stool. From anal canal. History of laxatives use. And history of blood transfusion. Ask about malaise, tinnitus, vertigo, cause of anemia. So these are very important.